Where in the world is sickle cell disease found? Have you ever wondered where sickle cell disease is most commonly found? Sickle cell disease, often referred to as SCD, is a genetic condition that affects millions of people around the globe. However, it is particularly prevalent in certain regions due to historical and genetic factors. The highest concentrations of sickle cell disease are found in sub-Saharan Africa, India, and the Middle East. These areas are considered global hotspots for the disease. In fact, countries like Nigeria, the Democratic Republic of the Congo, and India account for about 90% of all cases worldwide. In these regions, the birth prevalence of sickle cell disease can be as high as 2% of the population. In some parts of sub-Saharan Africa, it is estimated that up to 40% of individuals carry the sickle cell trait, which means they are genetic carriers of the disease. This high prevalence is linked to the historical presence of malaria, as the sickle cell trait offers some protection against this disease, influencing its spread. Sickle cell disease poses a significant public health challenge in sub-Saharan Africa. It contributes greatly to child mortality, with many children not surviving past the age of 5 due to limited access to healthcare resources. In India, there is also a notable number of affected individuals, especially among tribal and socioeconomically disadvantaged populations. In some regions, about 20% of children with sickle cell disease may die by the age of 2. The Middle East also shows a high prevalence of sickle cell disease, although the exact numbers can vary by country. Outside these primary regions, sickle cell disease is less common but still present. In the United States, approximately 100,000 people live with sickle cell disease, primarily within African American communities. The disease is also found in parts of Europe and the Caribbean, often due to migration patterns from areas with higher prevalence. Globally, it is estimated that between 300,000 and over 500,000 babies are born with sickle cell disease each year. The total number of individuals living with this condition has been increasing, thanks to population growth and improved survival rates in some areas. However, mortality remains high in low-resource settings where access to diagnosis and treatment is limited. In summary, sickle cell disease is predominantly found in sub-Saharan Africa, India, and the Middle East, with smaller populations affected in the Americas and Europe. Understanding this geographic distribution is essential for targeting healthcare resources and improving access to treatment, which can help reduce the high mortality and morbidity associated with sickle cell disease worldwide.